The number of new COVID-19 cases worldwide skyrocketed on Friday by more than 400,000, the most since the start of the pandemic. Half of the new cases were from major European nations, where there have been an average of 140,000 cases a day over the past week. Now that's more than the number of daily cases from India, Brazil and the United States combined. France has the highest daily average at more than 19,000, followed by the United Kingdom, Russia, Spain and the Netherlands. Now, as the continent deals with this sweeping second wave, European leaders are highly concerned to the point of cancelling a leaders' summit in November. And over the weekend, they began reintroducing lockdown measures across some of their biggest cities. But how effective will they be? Today, we're joined by Mark Shanahan, Associate Professor and Head of Department for Politics and International Relations at the University of Reading. It's good to see you again.
Pleasure to be here.
And we also connect with Dr. Marco Vincetti, Professor of Epidemiology and Public Health at the University of Modena and at Boston University School of Public Health. It's lovely to have you on the programme again as well.
Thanks for the invitation and happy to be with you.
Well, my first question goes to you, Dr. Shanahan. Now, all capitals of the United Kingdom are now under lockdown, along with more than half of England, where you are now banned from socialising with friends and family from other households, even at home. But it seems that many people are questioning the effectiveness of these measures. So what do these Tier 2 restrictions entail, and do you think they'll be effective?
Well, the government last week introduced a three-tier system. It doesn't start at low. We've gone well past that. So it starts at Tier 1, which is medium, which is no more than 6 people can meet. There are 10 o'clock curfews in pubs and restaurants. Tier 2, which cities such as London have gone into, you can't have any household meetings indoors. So you can't have 2 households coming together. Then Tier 3, which we're getting in the north, in the northern industrial cities, means no mixing indoors or outdoors, and all pubs and bars that don't serve food are closed. Now, this sounds quite strict, but actually it's a lot less restrictive than the lockdown we had back in March through to June, where nearly all shops were closed. Shops are open this time around, and people simply don't think it's as serious as it actually is. The cases are rising significantly. Hospital admissions are rising significantly and quickly. But we have a government that finds it quite hard to give bad news, so is kind of drip feeding the restrictions through. Doesn't have full control over the other nations of the UK, so Northern Ireland, Scotland and Wales, who all have their own government to an extent around this, and is also at odds with our political leaders in some of the northern cities as to exactly how these restrictions will come in. Overall, it really doesn't look as though they're going to work long term.
Well, cases have been surging again over the weekend in the UK and, of course, in Italy as well, Dr. Vincetti. As daily cases in Italy, it hit a new record of 11,705 on Sunday. And your Prime Minister actually announced today new restrictions to contain the virus. So what are the new measures in place, and do you think they will be effective?
Yes, the Prime Minister at 9 o'clock p.m. this evening, actually last evening, because it's 1 o'clock a.m. here in Italy. So 4 hours ago, the Prime Minister in a live conference announced that an additional decree of the President, of the Prime Minister, the President of the Council of Ministers. But this is not a lockdown. Just to be honest, this decree increases some kind of restrictions, particularly concerning, changing the timing of secondary school classes, reducing the capacity of the restaurants, closing all restaurants at midnight, not earlier, midnight, and giving the possibility to the bars to give out food and drinks until 6 o'clock in the afternoon, 6 p.m. After that time, people are allowed to enter the bars, but they have to sit down, and it's forbidden to consume drinks or food standing up. So these are measures. Lockdowns are allowed, but not issued. What does it mean? That the mayors of all cities are allowed to issue a lockdown, but this has to be done on a local basis. Rome, Milan, any small or large city can issue, depending on the number of cases and the evolution of the hospital admissions, a specific lockdown. But a national lockdown, as we had on February 23rd, and the tightest one, the tight lockdown, was issued on March the 8th. This was a very, very hard decision and a tight lockdown. It worked, because it worked, we must admit, but it was a very difficult experience for many reasons, economical, psychological, and so on. The social consequences were very high, but it worked in curbing the outbreak. Now, today's decree is much less tight, but it should work in containing the increase in cases, at least we hope. And so we are trying to balance. There is a trade-off between public health and the need to maintain, to keep the economic and social life alive.
And we all did see how Italy managed to overcome the first wave with these very stringent lockdowns, which of course no one really wants to go back into again. And well, Dr. Vincetti, how far do you think lockdowns should go in countries like France and the United Kingdom, where numbers are spiraling out of control?
Actually, is difficult because it depends. It's difficult to me to make assumptions and to make evaluation concerning other countries, because each country, we are a latent country. For instance, in our population, for instance, the elderly live very close to young people. We tend to have a lot of relationships. It's not to say that in those countries, in the other countries, those relationships are not working, but the family structure and life in Italy is probably different in terms of residence, in terms of daily habits, compared with at least northern countries. Maybe France is in the middle. So for Italy, it worked a lot, the lockdown, in terms of really decreasing the severity, the spread of the outbreak. So it was most useful, but it had a lot of serious consequences you can easily appreciate. I think that it might not be so effective in other countries, but it's difficult to me to make evaluation for other contexts. So please allow me to be prudent on that evaluation in order not to make incorrect assumptions.
Well, in the UK, Dr. Shannon, now scientists and the Labour Party, they've called for a circuit breaker strategy. What would this entail, and why won't the government listen to scientists?
The government listens to scientists. There is no one science, but it's quite choosy in which scientists it listens to. And it's saying at the moment that scientists are suggesting this three-tier system that they've introduced is going to be sufficient. Labour, the main opposition party, don't believe that that's the case at all. They believe we need a much harder lockdown, closing schools, closing universities, closing shops, and taking us back to the situation we were in March and April, where perhaps we were told stay at home, work from home, just exercise for an hour a day or so. The feeling is that if there were 2 weeks, 3 weeks, perhaps 4 weeks of this, it gives much more time for the government to get track and trace correct. Its tracking system has been poor up until now. It gives the NHS, the health service, a small breathing space to get ready for the winter, both with COVID and with other illnesses that will undoubtedly happen. And it resets for the country how serious this situation is. We've become a little bit complacent in the UK, and we're also not a very compliant people. In the summer, the government opened up for economic reasons. Now, perhaps, is time to rebalance back towards public health. But this is a government that has vacillated between a number of different positions. and have been a lot less than clear in the actions that citizens should be taking. So Labour, the opposition, is saying, now be clear, be simple, be effective. But because they're the opposition rather than the party in power, our government is very unlikely to listen.
And how are these conflicting statements affecting compliance and the level of public trust in the government and also its COVID policies?
From very early on, senior figures within the government were seen to be saying one thing and doing something quite different. And that breaks down trust in government. And we're at a stage where the government of the country is not particularly strong. We don't have a particularly strong prime minister. He absolutely hates giving bad news. And so we'll always try and water it down a little bit. And so for the average Joe and Jessica British member of the public, it's quite hard to follow the rules because the rules aren't clear. And there is a sense, why should we follow the rules when senior figures in government don't and are not punished in any way, are not censured in any way when they're found to be flouting the rules? So there has been a little bit of breakdown of trust and therefore rather a breakdown in following whatever guidelines are out there.
Now, Dr. Vincetti, Europe hasn't only seen an increase in infection cases, but also an alarming rise of hospitalizations and ICU admissions. Why do you think this is the case?
So actually in Italy, you're meaning in my country, in Italy, is that you mean? We are seeing not such a high increase in number of hospitalization or hospital admissions, both to hospitals or to intensive care units, and also in the number of deaths. The increase is much less than it was in the first part of the year, in the first wave, let's see. So we don't understand if it's simply an artifact that we are performing much more tests than before, than in the first part of the year, and so there may be an increase in infection which is real, but was hidden in the first part of the year. This is, and so far the number of admissions to the hospitals and the number of deaths is still too much, still too high, but not as high as in the first part of the year. And a second issue that I would like to outline is that we are seeing a different behavior of the infection and also of the admissions. In the first part of the year, the epidemic was mainly located in the northern part of the country and in several provinces in regions like Lombardy, like Emilia-Romagna, my region, and so on. Now, we are seeing the infection to spread in the remaining part of the countries. In the remaining provinces, we were spared to some extent in the first part of the year, but not that much in the severely hit provinces. Let's talk about Lombardy. We have a difficult situation in Milan, and we have a, let's say, rather good situation in Bergamo, in Brescia, in Lodi. You may remember even from, I think from all over the world, these names were familiar because these provinces were extremely hardly hit by the epidemic. So it seems some kind of immunity maybe. We are not sure about that. We are studying this occurrence, this behavior of the epidemic, which is quite interesting because it may also help us to prevent the further spread. But it seems that the higher was the infection earlier this year, the lower it is now. So, for instance, let's talk about Campania, Naples, Sicily, and so on. These regions are severely hit now, and Rome as well. This was not the case at all in March and April. This may be very interesting and important to better understand which is the behavior of this virus and of COVID-19.
And Dr. Shanahan, how do you think the government in the UK, how do you think they should be handling this situation right now to really critically contain the virus and also give time, just to have more time to come out with proper steps to overcome the economic impact and also, of course, the strain on the hospitals?
I think treat it as a public health catastrophe rather than rebalance too much in favor of economics. The economics will follow. We have to ensure that as many people survive and do not get ill through this pandemic. Largely in the UK, that means the government getting its track and trace and isolate system correct. That has been flawed from day one, and it's a with profits or for profit process. Take the profits out of it. Let's just get it working, put all of the people necessary to be involved in the process there to make it happen. Then have some very simple rules for people to follow. It may mean 2 or 3 or 4 short, sharp lockdowns over the coming months, but let's make that clear for everyone. Don't try and use this pandemic to divide and rule.
And Dr. Vincetti, now, of course, most of us are pinning our hopes on a vaccine to really end this pandemic. But we're now having increasing worries about people having access to the drugs. So once the vaccine or an effective COVID-19 treatment is developed, how would or do you think they should be distributed to the public?
Actually, as a physician working in public health, what you may easily imagine that our hope and our commitment is to have as many doses as vaccines available and distributed all over the country, all over the countries. So starting from people who are more exposed to the adverse effects of this infection and of the COVID-19 disease. So, we are still a little bit concerned about the possibility to have an effective vaccine. And this is the key issue. We hope to have it, but we are still waiting to see if it comes as we hope. We do hope. Once it is available, we are reasonably sure is maybe too much, but confident that it will be available. Our Prime Minister, a couple of days ago, coming back from a European Union meeting, told to the country that all doses of vaccines will be available to everybody who needs it, so almost the entire population, at least the elderly population, as soon as it becomes available. Of course, this is we are confident that this is true, and there is not a big concern in the country and even in the health professionals about this feasibility, availability. The key issue is that we have really available from the science, from factories, a vaccine really working and effective. So it's more a scientific issue than a public health issue, I would say.
Well, I'm afraid this is where we'll have to wrap up the discussion today. That was Dr. Marco Vincetti, Professor of Epidemiology and Public Health at the University of Modena and at Boston University School of Public Health. We were also joined by Mark Shanahan, Associate Professor and Head of Department for Politics and International Relations at the University of Reading. Thank you both so much for your incredible insights.
Thank you so much.